This video explores the impact of hyperbaric oxygen therapies and features the story of Delbert Buckley in his battle with Parkinson's disease. It illustrates the impact that hyperbaric oxygen treatments can have on your vitality and your overall health. First used to help deep-sea divers decompress from long and deep underwater dives, hyperbaric oxygen therapy has been applied to treat a remarkable range of medical challenges. It's been used as post-surgical therapy to help patients recover quickly. Professional and college-level sports teams use it to help elite athletes recover quickly and physically prepare for the next game. Progressive medical professionals continue to find new applications for hyperbaric oxygen therapy because it has proven to be effective. Today I'm talking with Delbert Buckley in Rupert, Idaho. Delbert has been a dedicated hyperbaric oxygen practitioner for more than 4 years. Delbert has an extraordinary story about what hyperbaric oxygen therapy did for him, and you should hear his story in his own words. Meet Delbert Buckley. So Delbert, how would you explain Parkinson's disease to someone?
Parkinson's is a neurological disease that's very debilitating. It causes a number of different side effects when you have Parkinson's. You have a tremor. It affects different people different ways. The way it affects me is my coordination, the way I'm able to walk, and the tremor. Those are the most critical things that it does to me. I can feel a little bit of what it's done to me mentally decline. I know that it affects different people in different ways, and that's pretty much how I would explain how it's affected me.
So tell us about your history with Parkinson's disease.
My neurologist has a scoring system that he has. When I went into him, I know I had the symptoms for probably 2 years prior to his diagnosis. But I went into him and he did give me a clinical diagnosis of me having Parkinson's disease. When he gave me that assessment, that was in it was just before Christmas in 2019. And he gave me an assessment at that time of a 21 was his numbering system.
As a note, Delbert's doctor uses both the Hone and Yar scale, which was named for its authors. According to Oxford Academic, the Hone and Yar scale is one of the most widely used staging systems for Parkinson's disease and has been around since 1967. His neurologist also uses the UPDRS, which is the Unified Parkinson's Disease Rating Scale. The UPDRS is also widely accepted and used. In the UPDRS, the higher the number, the greater the disease progression. The dramatic drop in numbers, which suggests an improvement in the condition, refers to the UPDRS numbering system. How did you discover hyperbaric oxygen therapy?
How I really started getting interested in hyperbarics for Parkinson's disease was my wife. We were driving with her. She has some underlying health conditions. She has fibromyalgia and a couple of other things that ailments that she has. And we were driving 2.5 hours one way to a clinic that was in Idaho Falls to do treatments for her. In the chamber, I was sitting outside the chamber waiting for her to get done, and the doctor came by and sat down and talked to me. And I told him that I had Parkinson's disease, and that was after I had been diagnosed. And he says, well, you need to be doing hyperbarics too. He says, this would be very helpful for you. So he sparked my interest in hyperbarics and the benefits that it could have for Parkinson's disease.
So what impact has hyperbaric oxygen therapy had on you?
I started doing hyperbarics in March, early March of that year, and I did hyperbarics from March until I went back to see him in June. And when I went back to see him in June, it was late June, he did my assessment that time at a 7. When he did that assessment, sat back in his chair, he pulled up my medical history on his computer, on his laptop, sat back in his chair and says, "Wow, man, this is unbelievable." He says, "Normally, if I have a patient who has a 5-number change in their Parkinson's assessment to the good, it is an astronomical thing. It's something that's very, very rare." And I had went from a 21 to a 7, 14-point number point change, and he says, normally you do not see patients that are getting better with Parkinson's. They're normally getting worse and progressively getting worse. So, but there's no question that the hyperbarics is my salvation in this with Parkinson's.
Hyperbarics has a tremendous impact on vitality and health. Olympian Michael Phelps, NBA legend LeBron James, NFL Hall of Famer Joe Namath are some of the famous athletes that use hyperbarics. But you don't have to be a world-class athlete to use it and benefit from the treatment. To discover more about how hyperbaric oxygen treatments can improve your health and vitality, visit the Oxygen Health System's website.